Hey guys, welcome back to another episode of The Chamber Guide. Today, our focus will be on the pharmaceutical industry. Of course, to the general public, the first things that pop into mind when you hear the word pharmaceutical would be the pandemic, medicine, hospitals, doctors, vaccination, and so on and so forth. That is just scraping the top of the barrel in the industry. When you dive in deeper, you will encounter a fascinating world that has diverse aspects, and yet each and every aspect is dependent on the other. We are talking about research, clinical studies, data analysis, manufacturing, distribution, supply chain, etc., etc. It's a business, and as per any business, it needs to be regulated. Policies need to be in place, and there will be challenges and risks no matter which part of the supply chain you're in. So to find out more about the challenges being faced by the pharmaceutical suppliers and also about what is being done to address the issues faced by the pharmaceutical industry in Malaysia, we have with us today Mr. Lim Teng Chyuan, the President of Malaysian Association of Pharmaceutical Suppliers. Mr. Lim, thank you for joining us.
Thank you very much for your invitation. I hope I can meet all the expectations you have on me.
I'm pretty sure you will. Now, Mr. Lim, before we proceed any further, could you tell us a little bit about your background and what brought you to be the president of Malaysian Association of Pharmaceutical Suppliers?
Thank you, Francis. Basically, I graduated with an honors degree in pharmacy in 1989 from the University of Science Malaysia. I further earned an MBA in Total Quality Management in 1997. My experience encompasses community pharmacy, wholesale pharmacy, regulatory affairs in pharmaceutical, sales, marketing, product management, strategic management, business policy, and general management. I have geographically worked in mainly Malaysia, with some experience in Singapore, Thailand, as well as Myanmar. I started wholly in the private sector, opting to serve 1 year as a pupil or a houseman pharmacist in Guardian Pharmacy. In this part of the world, we are called Guardian. In Hong Kong, it's actually Manning. We were actually offered to also take a posting in government hospital, but I chose to just do it in private. This was my first venture in the retail or community pharmacy setting. Then I continued another year as a fully registered pharmacist as a condition of my taking up the pupillage program. I moved from community pharmacy to industrial pharmacy, industrial sector, by joining Schering-Plough, then called Schering-Plough. I was product manager, initially in charge of regulatory affairs, so working with government, getting products registered. I took on additional product management functions from there. And in my last position in Schering-Plough, I was the business development manager. So my responsibilities in Schering-Plough covered Malaysia and Singapore. That's where my Singapore experience comes from. I was there for 3 years, left in 1994. The pharmaceutical landscape changed quite rapidly over the years, and Schering-Plough does not exist anymore. It has merged with Merck, the US Merck, in 2009. Then I was appointed country manager at Serono. I was there for 6 years. The company specialized in fertility treatment. So IVF, the kind of things where people need to become parents. At that time, the products were natural extracts, such as from urine of menopausal as well as pregnant women. Serono was working on a pipeline of biotechnology-derived hormones. And also, I helped develop the market for multiple sclerosis using beta interferon at that time. I left in 2000, before the biotechnology versions of fertility hormone products were launched. In 2006, Serono was sold to Merck Germany and is now part of Merck Serono. So it's just a coincidence that the two companies I worked for initially were merged with the two Merck companies. After leaving Serono, I became an independent consultant in the pharmaceutical industry in Malaysia. But for 3 years, I was engaged exclusively to Diethlem, now called DKSH, based mainly in Myanmar. In Myanmar, my responsibilities involve managing a small chain of modern pharmacies, sales, marketing, as well as marketing development of in-licensed products. Due to the political developments in Myanmar, I was transferred to DKSH Bangkok regional office for a short while. But with the deterioration of Myanmar politics, I had to return home in 2004. I continued on with my independent consulting in Malaysia for a while, and then I joined the current company, Medical Sdn Bhd, in 2006. Medical is in her 56th year of operations in Malaysia, actually almost my age. I started as the head of pharmaceutical division and was promoted to general management after 1 year of service when the managing director retired. I was further promoted to managing director the next year, for which I remain to this day. As for your question about MAPS, I will go into it a little later, but suffice to say, I was an early director in the association. The founding president was Mr. Razmi Rahmat. Following his failing health, he stepped down and I was elected to lead the association in 2016. MAPS remains ever grateful to the late Mr. Razmi for his pioneering work. May God bless his soul.
Thank you so much. You have a very, very impressive record. Now, Mr. Lim, could you briefly tell us a little bit about the Malaysian Association of Pharmaceutical Suppliers, or MAPS as we call it, and its origin, and a little bit about the various programs that it conducts?
Okay, thank you. MAPS, as it is called, is the acronym for Malaysian Association of Pharmaceutical Suppliers. It is an association formed in 2011. MAPS is an association whose ordinary membership is based on companies, not individuals. We also have an associate membership category, which accepts individuals who share our goals and objectives. We started with around 25 ordinary members, and at last count, we have grown to 35 ordinary members over a course of 12 years. Currently, our board of directors are elected to serve on a 3-year term. There are 9 members on the board. Our members are made up of home-bred companies, such as Medical, and locally incorporated companies or foreign-owned companies. So it could be a company that has an origin in India, but they need a local operator, and they incorporate the companies here, and these are also some of our members. Some of our home-bred companies have even ventured outside of Malaysia. Some have started operations in Philippines as well as Indonesia. Okay, the first gathering of like-minded interested group for the formation of MAPS was in 2011, and it was formally registered in the month of November of the same year. It was formed to fill a missing piece of the trade representations in pharmaceutical industry. What differentiates MAPS from the 2 existing trade associations is that we represent companies in the pharmaceutical industry that focus on affordable medicines, mostly off patent, which are sourced internationally. We want to do this in a sustainable manner for the country and companies. The industry was going through major changes at that time of our formation, with the introduction of what is called the Pharmaceutical Inspection Cooperation Scheme, PICS we call it, which is the Harmonized Good Manufacturing Practice, GMP standards of inspection, and further introductions of other measures to assure the quality of medicines, such as bioequivalence and Zone 4B stability studies. All these measures are costly and can take a toll on companies, especially small companies which make products cheap and in a competitive landscape. We are actively involved in this regard to move our members in meeting the standards required and still make the products affordable to the general public. We had to chase a deadline to ensure that our members who were sourcing from non-PICS countries could work with their suppliers to meet the PICS GMP inspections by our National Pharmaceutical Regulatory Agency, called the NPRA for short, or it could also be audited by another PICS member country's health agency. Otherwise, if we don't get this certification, the supplier will have to be discontinued from supplying to Malaysia. Towards this end of supplying affordable and good quality medicines, we focus on trade practices, marketing code of conduct and ethics, regulatory affairs, and social aspects. We conduct these engagements with our members internally as well as organizations outside. Within the organization, we have our trainings, workshops, social events, and also we conduct surveys from time to time relevant to our goals and whatever upcoming issues that we will be engaging with. Externally, we engage with government as well as non-government organizations. And also within the pharmaceutical industry, I mentioned there were 2 other pharmaceutical associations and professional bodies as well in the healthcare sector. Naturally, most of our engagements are with the Pharmacy Services Program as well as the NPRA. A lot of our members are very involved in supplying to the government, so we have no choice but to engage with these agencies. A lot more can be learned about MAPS by visiting our websites. If you look to this site here, that would be our website. Thank you.
Right. Thank you so much for that. Now, we know that the association is apolitical. However, with the current situation in the political situation in Malaysia at the moment, I know it's rather stable now. Will there be any impact with new policies or all policies that have to be renewed? Any impact on the association as well as its members?
Indeed, Francis, you said it correctly. We are apolitical. As the right to healthcare is blind to political associations, it is also blind to race, religion, color, and creed. We have been engaging the government of the day since day one when we were formed and have experienced all the various administrations, be it led by Barisan Nasional, Pakatan Harapan, Barisan Nasional, as well as the current coalition government, even in our relative young existence of 12 years. So on average, we saw 1 change of government for every 4 years since our foundation. The good thing about this industry is that the government of the day, no matter under which administration, realizes the importance of healthcare as a cornerstone to a productive and prosperous country. That makes our job a little easier, and we are frequently involved in engagement sessions with them over policies, initiatives, and any legislative proposals and changes. In this regard, the government servants, whom we have most of our engagements with, are single-minded in their resolve to make good quality healthcare for all. Government administrations may come and go, but the civil servants formulating most of the policies and initiatives remain in service until such time that they retire. Having said that, during the MCO years, there was significant turnover of government agency heads. But there is still continuity as the replacements are the second echelon within the same agencies who have also been engaged in the engagements and promulgation of policies. So in this regard, we do not see any major impact to our members. However, we do hope that the government will look into the long-standing problems of the healthcare industry, which they have inherited from previous administration and just keeps getting passed on to the new administration. And most frequently is because of budget constraints. The new administration has given extra allocations as at the end of last week, certain announcements of budget was made. And these extra allocations, we hope, would be part of the solutions to all these problems. But money is just part of the issue. The other thing is that the ministry needs to work with all stakeholders, such as the suppliers, to make this work better. And in this regard, we believe that the impact should be positive to our members. Thank you.
Thanks for that. Now, when we talk about medical or anything pharmaceutical, it brings to mind the global pandemic, which we all went through just about 2 years ago. In general, what would you say was the impact of COVID-19 to your association and your members?
Yeah, as COVID-19 is a healthcare problem at its core, our role remains in focus as we are part of the solution. However, in the context of Malaysia, the COVID-19 pandemic cannot be separated from the government's Movement Control Order, in short called MCO, and its associated standard operating procedures, the SOPs. And these actually carry stiff penalties of fines and even imprisonment and closure of premises. The impact of the virus and MCOs has universally been negative on businesses, including ours. This is largely caused by the reduction of patient flows to the various healthcare outlets. The worst effect seems to be in private market, while the government sector was also affected, albeit to a lesser degree. All companies could not proceed with business as usual in many areas, such as working hours, staff strength, and the range of services that could be provided. This impacted the company's bottom line, particularly when salaries and remunerations had to maintain at a time of depressed revenues. Among patients, the fear of catching the infection caused some reductions in sales of non-COVID related products. The requirement under SOPs, example, masking and distancing, actually reduced footfall in retail outlets and clinic visits. A survey among our members showed cash flows generally declined, partly due to the reduced sales, and sentiments remained weak in this area. Additionally, inventory became stagnant due to sales declines. As a result of the reduced international cross-border activities, because airports, ship ports, they were all closed or activities were limited. Transportation costs got inflated, contributed to higher landing costs. In managing the negative impact, most of our members did not resort to drastic human resource interventions because we still could operate, albeit less. Most chose to rationalize inventory costs, fixed allowances, and A&P expenses. The government did offer aid to all qualified companies. At least 11 of our members who are small and medium enterprises qualify for government aid. But surprisingly, not every company chose to depend on government aid, with slightly more than half that did. This was attributed to the conditions set forth by the government when receiving the aid, example, moratorium on staff layoffs. In terms of revenue, if a member had the right products, they would have a windfall. So if they have vaccines, they have masks, or they have some antiviral, they may have some windfall. However, as the focus shifted, some members also saw some declines. Citing the social distancing rules, work from home, and masking, there were significant declines in respiratory product sales because people are not getting airway infections. Additionally, some long-term patients were lost to follow-up because they fear that when they go and visit a clinic, they may actually catch an infection from somebody there. So some patients who could wait for treatment, which we call elective treatment, also sought to postpone their treatments. So there were some declines in the non-communicable diseases market. In the various permutations of MCOs, you may have heard of it. We have different levels of strictness in terms of the movement control orders and the ever-changing SOPs. Many of our members were caught in a tight spot because policies can change within 24 hours. However, they know the supply of medicines has to be as usual, and it was their duty to support the supply chain. But these restrictions and interpretations on the rules made some of our members fear being caught on the wrong side of the MCO rules. So initially, our members could continue operation with a simple rule of providing employment letters supported by the pharmacy poison A license. However, later the rules became more complicated, where we needed to get the approval letters from a different ministry instead of the Ministry of Health. So, and we had to get this through a portal, which is shared by everybody, including those who are running supermarkets and sundry shops. So the system became very overloaded. So that was a bit of a complication. It was a difficult time. But we were able to engage with the ministry to circulate whatever changes in policy quickly to our members so that they are clear about where they stand in terms of operations. Thank you.
Thanks for that. Now, Ms. Salim, we are coming to the end of part one, but I'd like to ask you one final question before we wind up part one. Were there any special actions or roles carried out by the association during the pandemic, either by the order of the government or through the initiative of the association itself to help the people of Malaysia?
Okay, for the most part, our biggest role is we need to keep the operations going. Medicine still has to be supplied. Okay. However, some special actions were carried out by our members due to their ability to get involved in the initiatives. I will give two examples. One of our members, by the name of Hyphen, supported the hospitals in their corporate social responsibility initiatives. They supplied medical-grade sanitizers, cleansers, as well as nasal sprays to our frontliners so that they could disinfect or clean themselves in order to prevent the frontliners from getting an infection unnecessarily. So these three COVID-19 designated hospitals were Selayang, Serdang, and Pulau Pinang hospitals. And during the height of the pandemic, there was a search for antivirals. They don't care what it is, they'll just try. As long as it's antiviral, they try and use it to treat, rather than prevent, but to treat the infected patients. So one of our members, Medispec, has a source of an antiviral called Favipiravir. They were able to supply a significant amount to be used by the Ministry of Health in testing its efficacy in treating COVID-positive 19 patients. Of course, the results weren't that encouraging, but anyway, we did our part to contribute to the medical knowledge of what works and what does not work. So during the MCO, it was nearly impossible for our association to meet physically to plan our collective actions. However, we could give feedback to the ministry, especially the Ministry of International Trade and Industry. At that time, due to the urgency of access to new technologies related to COVID-19, there was a proposal paper to the World Trade Organization on the waiver from certain provisions of the TRIPS agreement for the prevention, containment, and treatment of COVID-19. So we similarly could give feedback to the Ministry of International Trade as to why it is important that this initiative has to be supported. As president of MAPS, I was also invited to give a talk, a webinar on protecting business continuity for community pharmacists, presenting mitigating the impact of COVID-19 in regard to ensuring the continued supply of medicines. Because the moment that patients drop off treatment, the outcomes would be quite bad. This was a problem at that time. As I recall it, there was a huge shortage of antibiotics, among other things. The problem was due to multiple factors such as closure or reduction of factory capacities, closure and limits on movement, and national priorities. For example, India at one time, if you recall, banned the export of some medicines to ensure sufficiency for their own population. And also the world is very dependent on limited sources. There is also increased cost of logistics, port congestion due to the reduction of workers in the port to clear the cargo. And also there's a generalized hoarding as well, and a general atmosphere of fear of the unknown. This was also a time when MAPS members' ability to provide generic alternatives, like I said, there was a shortage of some antibiotics. We provided generic alternatives as well as analogous substitution to help alleviate some of the supply issues.
Okay, thanks for that, Mr. Lim. We have come to the end of part one of our conversation. Now, thanks for watching. When we come back in part two, we will talk about the uncertainties in the business of pharmaceutical supply, and we will also find out a little bit about what's happening in the background with regard to pricing of pharmaceutical products. Thank you for watching.